And we're live. Hello, everyone. Before I begin, I'd like to acknowledge that we are gathered on the traditional and unceded territory of the Mi'kmaq people. I want to welcome everyone here. My name is Mike Kelloway. I am the Member of Parliament for Cape Breton Canso and the Parliamentary Secretary for Fisheries, Oceans, and the Coast Guard. It's my honor and my privilege to be here today to discuss the recently announced federal budget for this year. As you all know, the budget is crucial, and it's a crucial one for the Canadian people, as it will dictate the course of our country's economic and social policies for the coming year. Healthcare, and I'll repeat, healthcare has always been a top priority for the Canadian government, and this budget demonstrates that very commitment. I'd also like to extend a big thanks to Cape Breton University for having us here today. I think every second day we come, we'll make announcements, David, if that's okay with you. But it's my honor to introduce to you today the Honorable Jean-Yves Duclos, the Minister of Health. And I want to tell you a little bit about Minister Duclos. Minister Duclos is a well-published author, conference speaker, and economics expert with a long and distinguished career as an academic. Before entering politics, he was the director of the Department of Economics and a tenured professor at the Université Laval. Minister Duclos has also served with several well-known policy research organizations and has been recognized with numerous prestigious grants. In 2014, he was elected a Fellow of the Royal Society of Canada, the highest accolade bestowed on Canadian researchers. Following his election in 2015, Minister Duclos was appointed the Minister of Families, Children, and Social Development, later assumed the role of President of the Treasury Board, and now, of course, he is the Minister of Health. Well, last October, in the midst of the ongoing COVID-19 pandemic, he took on a whole set of challenges as Minister of Health. And he has done that with grace, with dignity, with leadership, with collaboration, and with a focus on improving healthcare for Canadians from coast to coast to coast. So, ladies and gentlemen, please welcome Minister Jean-Yves Duclos.
Bonjour tout le monde. Good afternoon, everyone. It's so nice to be in wonderful company of so many happy and smiling people. I know that everyone seems to be smiling on the beautiful island of Cape Breton, which I believe speaks a lot about the energy and the commitment that we see all around this place. And talking about a smiling and energetic and committed person, Mike, thank you very much for your kind introduction. You might know that Mike is a very proud CBU graduate, which we know CBU we also believe to be. I think this is what everyone in the province or even in Canada would agree to say that we have here the top ranked nursing school in the province. Shh, don't say that outside of this room. We also one of the most diverse universities in Canada. Thank you, David, and so many others for your leadership on that ground too. And obviously, very, very grateful. That's why I'm smiling to be working with Jaime and Mike in not only in this community today, but obviously also in Ottawa. It's very difficult to escape the attention and the energy of Mike and Jaime in Ottawa. They are fierce promoters and advocates of their constituencies and their constituents. They speak very highly of Cape Breton University every time they have the opportunity to do so. So we can be pleased and proud of what they do, but most importantly, can be pleased and proud of what they can do because of being representatives of this great community here at Cape Breton University and throughout the area. So, as a matter of fact, it's very hard to find other ministers who are not being chased by Mike and Jaime when they are in Ottawa. And that speaks also to the ability of bringing investments and support to the people in this community. So I was pleased to hear that my colleague, our colleague Dominique Leblanc, was here recently. You may have met him as a very committed person too, and I'm very proud that he was, with your leadership and partnership, President Dingwall and everyone else in the leadership and the staff, able to support the important center of discovery and innovation that will be created soon in this university. So congratulations for that. But that's an outcome, and what leads to a great outcome is a great level of work. You know, it's strong work, committed work, engaged, team-based work that leads to these significant outcomes for this community and for our country overall. Now, Jaime has also been a champion for the greater use of the abilities and talents of family physician assistants. Jaime has been pushing for expansions of scopes of practice for workers, better teamwork among different types of workers who all play an essential role, and again, in the context of physician assistants in particular. He's also been emphasizing regularly the importance to support our nurses on the front lines. We're facing, as we know, significant workplace challenges and pressures. Now, this is not a reason to be afraid and scared as the new students you may be. This is a reason to be even more supportive of your passion and compassion. You're there because you want to make a difference in the lives of people. And being a nurse is one of the most obvious and most important ways to make a difference in the lives and in the health of loads of people that we care for. Again, thank you for the faculty, the staff, the students, the nursing students in particular, and to you again, President Dingwall, for hosting us today. It's been a pleasure to meet David a bit more. We met a few years ago in Ottawa. You may know is a much more experienced and wiser former Minister of Health. Now, in times where there were all sorts of challenges too, he addressed them really well. And you may know he gave me lots of advice just a minute ago on how I can do a better job. So I'm grateful for that as well, especially in the context of rural and remote communities. I'm not sure if it was you, David, but someone in your era said that we have a two-speed healthcare system in Canada because we have rural and urban healthcare. So access is key. Yes, no, we don't want to see user fees. We don't want people to access healthcare on the basis of their ability to pay. We don't want that to happen. But we have to recognize that there are access issues in Canada, and many of them are driven by the differences of conditions and circumstances between rural and remote and rural and urban areas. So today I have a 2-hour speech, so I hope you're ready, because I'm going to speak about budget 2023, but now obviously won't take too much of your time, being very busy people. Mais je veux parler quand même du budget de 2023 parce que comme la ministre Freeland et le premier ministre Trudeau l'auraient dit s'ils étaient ici aujourd'hui, il y a un gros élément du budget 2023 qui porte sur les investissements en santé que l'on veut faire. Ce sont des investissements qui sont reliés à l'entente que nous avons eue depuis l'annonce le 7 février dernier de l'investissement majeur du gouvernement canadien au cours des 10 prochaines années. That offer, which the Prime Minister made on February the 7th in Ottawa to all premiers who were all there, that offer was subsequently accepted by all premiers. And it was accepted because it was built on common ground. We had been working prior to February the 7th with I had been working with my colleagues, health ministers, for more than a year, preparing the fact that common ground was going to be key, not only in that announcement, in those agreements, but most importantly, for the work to do collectively in the next year and years. And those common pillars are reinforcing access to family medicine, especially in rural and remote communities. B, investing in better mental health care services, especially for younger Canadians who sometimes find it very struggling, very challenging to access at the right time, in the right way, the mental health support that we all deserve and need in our lives. We're all human beings, and we all sometimes early, later in life need support, including mental health care support. Then supporting health workers, because the reason we have and we still have a healthcare crisis is that we have a healthcare workers crisis, mostly around the need to retain the existing healthcare workers, including the existing nurses, because the young nurses, when you go and work in the workplace, you will value, and in fact, you will need the support of older, more experienced nurses. Then to recruit more of them, to train more of them in wonderful settings, such as the ones we just visited a couple of minutes ago. Then to recognize the credentials of those that may have been trained elsewhere in Canada, but equally importantly, the credentials of those that have been trained internationally and would like to come to live and to work in wonderful communities like the one we are in today. So to make sure that when people come from outside of Canada with the strength and the pride of their diversity, adding to the diversity that we already have in Canada, they can quickly use their talents and expertise to serve the needs of Canadians and Cape Bretoners. How do you say that?
Right.
Cape
Right.
Bretoners. Well, merci. So that's why those $200 billion announced in February and confirmed in the budget are there, supporting workers, investing in mental health services, investing in better access to family medicine. And I was going to forget, but it's essential. And we discussed that, David and I and others just a moment ago, better use of data. That's because data saves lives. As nurses, you see this every day. As young as students, you also feel that. Now, when you want to care for someone, you need to know the conditions, the history, the test that person may have had, and that you require to give the fastest and best possible care to those people. Unfortunately, we are a bit behind in Canada, including here in Nova Scotia. Although we're making progress, we're a bit behind compared to other countries, in particular in Europe, where we're using better the technology and the data to reduce costs, increase benefits, and to facilitate teamwork. Because when nurses work with physicians, when physicians work with pharmacists, when pharmacists work with lab technicians, we need to exchange data on the conditions of those we care for in common, that is the patients. So this is essential, supporting data. But let me come back to supporting health workers. We know how struggling they have been during COVID-19. Many of them fell sick. Some of them had to leave. Some of them have been thinking of leaving. Fortunately, that is starting to change, because in particular in Nova Scotia, and I want to compliment the collaboration that we have had with the provincial government, with Minister Thompson in particular. I don't know about you. She's a nurse, by the way. If and we should be proud of that. She and I have been working over the last year and a half, to make sure that we are aligned and supportive of each other. So we know there are challenges, and these challenges will last. But because of that work that we're going to do together, we can be optimistic for the future of our system, but more importantly, the future of workers and the conditions of patients. So I will add that as we do that, supporting workers is essential, including supporting continuing care assistance, which we also call personal service workers in other provinces and territories. Personal service workers, continuing care assistants, have also struggled. We know and remember what happened in long-term care homes across Canada. The conditions of work dictate the conditions of care. So if we want to care for seniors in Canada, and we need to take care of seniors in Canada, we also need to take care of those that do take care of the seniors, that is a continuing care assistance. And that's why in the budget, there is a $1.7 billion in addition to the dollars I mentioned earlier to support hourly wage increases and to support the working conditions for those workers and related professions. Before, and then I really want to be true to my word before ending. I'll mention that Minister Fraser, Jaime, Mike, and other members of parliament in the caucus here in Nova Scotia have insisted for a long time that we should be enhancing and supporting what is called the Canada Student Loan Forgiveness Program for doctors and nurses in rural and remote communities. You know what I mean. That program has been in existence for some time. The budget of last week announced that we would be enhancing in terms of the coverage of communities, that program, so that nurses and physicians who want to and know they will like to work in remote and rural communities can have access to additional financial support so that this is possible and effective. In addition to the permanent elimination of interest for Canada's student loans for all students that have come into effect on April 1st for the loans that are federal loans, not necessarily the provincial loans. Donc, en résumé, tout ça, c'est toujours dans le même souci, le même soin de s'occuper des gens, des travailleurs en particulier, pour que ces personnes qui donnent leur carrière, leur temps, leur énergie, parfois même qui mettent à risque leur propre santé physique et mentale, et parfois même leur propre sécurité, leur intégrité physique, pour que ces gens-là puissent être au service des patients qui en ont tellement besoin. So, thanks to the leadership, thank you to the leadership and the staff of Cape Breton University, for all of the health care workers and partners that are working with us in Nova Scotia, some of them in this room. We have a great country, we have a great community. Proud and grateful for all of you to keep caring for it. Merci, une très bonne journée à tout le monde.
Thank you, Minister. And you spoke of the budget. And when you speak of the budget with respect to healthcare, there are transformational dollars that are attached in that budget, that are within that budget, that hit some key points in healthcare in Nova Scotia significantly. But you don't do that alone. You do that with partnerships. I see Janet Hazelton with the Nurses Union, the work that you do, the work that nurses do, doctors do, PCWs do, staff and trainers and educators in this very institution are very much part of being the solutions provider, of getting to a better place in terms of public health care. So I wanted to acknowledge that. The next speaker is someone that's right next to me, behind me, I think, Jaime Battiste. Jaime and I came into politics at the same time, but we've known each other for about 18 years, and it started here at Cape Breton University. As with a lot of things in my life, started at Cape Breton University, a lot of friendships with former coworkers, students, faculty. I met Jaime in 2005. We got to know each other, and then 2019, he said, "I'm running for politics." And I said, "Funny that, so am I." But Jaime is a dedicated MP, in particular focusing on healthcare. There's not a day that goes by in caucus, whether it be Atlantic caucus or national caucus or in the hallways of Ottawa, that he's not pushing, bringing people together on the topic of healthcare. A real leader in that respect, in particular when it comes to healthcare, among other things. So without further ado, I want to give Jaime a few moments to say a few words. Jaime?
Thank you, Mike. Well, manalo tiyo. Well, dasi dugo yung no kis ko dasi giti kay wono tijita la agana gogan. Good afternoon, everyone. It's great to be back at CBU. This is my third visit here this week. talking about health and talking about growth and talking about the great things that are coming to this university. And, you know, when me and Mike have to huddle and say, you know, which minister do we need to bring to Cape Breton? Over and over, we kept saying, we need to bring Minister Duclos. We need to talk health, because in Cape Breton, that's what's on people's minds. If you knock on the door and they have 3 issues that they want to talk about, most of the 3 are going to be about health. I was in a Tim Hortons drive-through, and I have to share this story because I shared it with Caucus. And I was pulling into a Tim Hortons drive-through at Howie Center, and I pulled up to the window, and the person who was working there looked at me and said, "You going to fix that healthcare system?" And I said, "Well, I'm a federal MP. You know, that's provincial jurisdiction, right?" And she said, "I don't care whose jurisdiction is, fix it." And so we started, but we had been talking about this for a long time. And I have to really acknowledge the hard work of Minister Duclos and Minister LeBlanc, who we had here at Cape Breton University this week. They went across the country talking to premiers about health and about what we needed across this country. We all know what the pandemic has done to our healthcare system and some of the strains around that. And we all know that the investments needed to be there. But to find common grounds on how we were going to do that, pots of money, as well as the outcomes that were going to be attached to that, and make sure that we had that within the budget of 2023. I can only say what Mike said earlier. This is going to mean transformational changes to our healthcare system in Canada. In our budget, you know, we're looking at a long-term process. This is going to be over 10 years, more than $200 billion to make sure that we're getting our healthcare systems back on track. And one of the key parts of that is going to be the people who are working in the healthcare field. And I want to acknowledge the nursing students here today that are both in the front and in the back, and all of those to come, and all of the teachers that are there. As a former CBU prof, I know how hard you work for these students, because we need them. We need them in the healthcare moving forward. We need them in all professions, whether it's nursing, nurse practitioners, first responders, physicians, assistants, physicians. I could go on and on. You know, if you're a parent at home in Cape Breton, I want you to go home and tell your children, no matter what the age they are, we need them in the healthcare field. And so help us support that, because we're going to need them. With all the investments, we still need the people who are going to be doing that. And that's why we're really happy to be here with President Dingwall today, and all the great things that he's doing, and the finding the common grounds between provinces and federal governments, all for one thing, is to make sure that our healthcare system in Canada remains one of the best healthcare systems in the world. And we're going to continue to fight for that. We're going to continue to fight for Cape Bretoners. Thank you.
Thank you, Jaime, for those words. And our last speaker is President Dingwall, and I don't think I need to rhyme off 10 pages of his accomplishments, other than to say this. With President Dingwall, with David, I don't think I have to convince anybody in this room or anybody on this island how advocate's probably it's not the right word, the passion for Cape Breton and the fight for Cape Breton every single day. And I do get texts from David every single day. But I'm glad I do, because you know he's in Cape Breton's corner. He's always been in Cape Breton's corner. And that's why I'm glad he's in the position he's in now. Ladies and gentlemen, David Dingwall.
Thank you very much, MP Kelloway and Jaime Battiste. Ladies and gentlemen, Minister, I understand the importance of your time. And we at CBU are very appreciative of you taking the time to come to us and to engage with our Dean, the School of Nursing, Dr. Kim Lamarche, and our nursing students, as well as members from the post-bac and healthcare management. It's not often that you get a senior minister of the government of Canada who comes and he listens. The only thing that I could add to what has been said is, Minister, if you listened to what Janet Hazelton said and what I said, you'll be fine. And let it be said, we love our nurses, don't we? The ones in the system, the ones who want to graduate and go into the system, we're delighted in terms of their accomplishments. So, Minister, let me extend my sincere appreciation to you and to your staff for making CBU a part of this visit to Cape Breton. We're so pleased to be able to show you our campus, have you meet some of our outstanding students, and to share with you our plans to help improve healthcare for citizens across the province and indeed across the country. We were extremely pleased to hear of the many investments in Budget 2023 as it related to healthcare. In particular, the focus of support for students pursuing careers in healthcare and the need to provide more access to family care providers. Minister, as you know, these investments are in direct alignment with Cape Breton University's strategic healthcare initiative. That initiative includes the development of 5 items: a school of medicine, a health and counseling center, a patient collaborative care clinic, a Bachelor of Social Work degree, an ever-growing nursing program, and a center for healthy aging. That's what we want to contribute to Nova Scotia, to rural Nova Scotians, and to Canadians one and all. One of our strategic goals is to champion the island's prosperity. Our initiatives are a part of the healthcare solution. It won't be solved, and we can't solve every challenge, but we are committed to continuing doing all that we can. Healthy communities are thriving communities. We look forward to continuing to work with you, Minister, MPs Kelloway and Battiste, as well as our provincial counterparts in Halifax, to make our communities and our country the healthiest that they can be. On a personal note, I want to thank the Minister and to congratulate the Minister for the way in which he conducted himself, probably one of the most difficult times in federal-provincial relations as it relates to healthcare. He did it with dignity, he did it with class, and he did it with thoughtfulness. So, sir, I congratulate you on your role as Minister of Health for the Government of Canada. And on behalf of the Board of Governors, the faculty and staff at Cape Breton University, we wish you the very best in the months and the years ahead. Congratulations.
Thank you so much. That concludes the speaking portion of this event. I'll just sum up by saying, Minister, thank you for being here. President Dingwall talked about dignity and grace and focus on action. There's a great philosopher, you may not have heard of him. He's from Glace Bay. He was my dad, in charge of mine rescue for many years. And he would always tell me, which I think he stole this from somebody, but that crisis reveals character. And that has stayed with me because with healthcare, Minister, you're leading the charge from a federal perspective and working with the provinces. But your character has shown, as David has mentioned, time and time again, in focusing on being a solutions provider to the province of Nova Scotia. I would say a crisis reveals character again, because you're stepping up to the plate, to the unions that are in healthcare, to the nursing union, you're doing your part, to community advocates, you're doing your part, to staff and faculty, and to Cape Breton University, you're doing your part. Look, the road is long when it comes to healthcare, but I really believe that we're on the right path. We're on the right path in terms of investment. We're on the right path in terms of Cape Breton University being a lead educational institution and destination of choice for education. And we're on the lead when it comes to focusing on the task at hand, is helping Canadians, helping Nova Scotians, helping Cape Bretoners get the healthcare they need. With that said, I'll conclude my remarks. I want to thank all of our speakers. I want to thank all of you here today. I believe if media is here, talk to Guillaume. Guillaume, if you can raise your hand, or there you are right there. You can go over to Guillaume and we'll be there to answer your questions. Thanks for spending some time with us today. Really appreciate it. Take care.
Thank you. I will, and we will start the Q&A section. I don't think we have any reporters in the room, so I'll move to you online, André. André, to you.
Oui, merci Guillaume. So if you are a reporter online and you wish to ask any questions, you can please use the raise your hand function. We ask that you limit yourself to one question and one follow-up. And unless I've stated it, you can please indicate your name and media outlet before asking your question. Si vous êtes journaliste et vous désirez de poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi. Sauf que je l'ai dit, veuillez identifier votre nom et votre média avant de poser une question. So I'll open up the line for questions now, if you want to raise your hand. Last call for questions on our Zoom folks. Dernier appel de questions. No. Pour le moment, il n'y a pas de questions sur Zoom. At this time, there's no questions on Zoom. Guillaume, la parole est à vous.
Thank you. This closes the press conference. Thanks to CBU again for hosting us today, and have a good evening.
It's
Minister?
good, because if there had been questions, difficult questions, I would have turned to you, because you're the specialist. Thank you everyone for joining us today.
Merci.